New hospital regulations taking effect in 2026 are fundamentally changing how you receive care, how much you pay, and what rights you have as a patient. And most people are terrified of the penalties, so compliance is finally happening. If you're learning about healthcare changes that will directly affect you, hit subscribe. We're breaking down the 2026 rules that hospitals don't want you to understand. Let's talk about mandatory staffing ratios. The 2026 federal rules require minimum staffing ratios nationwide: 1 nurse per 4 patients on medical surgical floors, 1 per 2 in ICU. Hospitals that violate these ratios face Medicare reimbursement cuts and public reporting of violations. Here's why this is massive. Understaffing has been killing patients for decades. Nurses managing 8 or 10 patients can't provide safe care. The new ratios will force hospitals to hire more nurses. Your care in 2026 will be dramatically safer because your nurse isn't spread impossibly thin. Now here's a rule that changes everything about medical records: Universal Health Information Exchange. By mid-2026, all hospitals must participate in nationwide health information exchanges. When you show up at any ER in America, they can instantly access your complete medical history from any other facility: medications, allergies, past surgeries, chronic conditions, previous imaging. Here's the game changer. This prevents medication errors, eliminates redundant testing, and speeds up diagnosis. It also means you can't hide medical history. If your doctor's shopping for opioids, every ER will see your prescription history. Privacy advocates are concerned, but the patient safety benefits are undeniable. Let's talk about hospital-at-home expansion. New 2026 rules allow Medicare and most insurers to cover hospital-level care delivered in your home for dozens of conditions: heart failure, pneumonia, COPD exacerbations. Even some post-surgical care can now happen at home with remote monitoring, visiting nurses, and telemedicine. Here's why this matters. Hospital-at-home programs show better outcomes, lower infection risk, better sleep, and cost 30% less than hospital stays. You're healing in your own bed, eating your own food, sleeping through the night. If you're hospitalized in 2026, ask if hospital at home is an option. Now let's discuss maternal mortality reduction requirements. The 2026 rules require hospitals with obstetric units to implement evidence-based protocols for recognizing and treating obstetric emergencies: hemorrhage, eclampsia, sepsis. They must have emergency equipment immediately available and staff trained in emergency obstetric care. Here's what enforcement looks like. Hospitals must publicly report maternal outcomes. Facilities with high complication rates face investigation and potential loss of obstetric certification. This might save hundreds of maternal lives annually. If these new rules are changing how you see healthcare access, make sure you're subscribed. We're exposing regulations that fundamentally reshape the patient experience. Let's talk about scope of practice expansions. New federal rules override many state restrictions, allowing nurse practitioners and physician assistants to practice at the top of their training without physician oversight in underserved areas. NPS can diagnose, prescribe, and manage care independently. Here's why this is controversial but necessary. Physician shortages mean millions can't access care. Expanding scope of practice puts qualified professionals in gaps that would otherwise go unfilled. Evidence shows NPS and PAS provide comparable care for most conditions. In 2026, you might see a nurse practitioner for your annual physical, and research says your outcomes will be just as good. Now here's a financial protection that's huge: medical debt reporting ban. Starting 2026, medical debt cannot appear on credit reports or affect credit scores for 2 years after it's incurred. After 2 years, only unpaid medical debt over $5,000 can be reported. Here's what this means. Medical emergencies won't immediately destroy your credit. You have time to negotiate bills, apply for financial assistance, and set up payment plans without your credit score tanking. This rule doesn't eliminate medical debt, but it stops it from immediately ruining your financial life. Let's talk about telehealth permanence. The 2026 rules make pandemic-era telehealth expansions permanent. Medicare and most insurers must cover telehealth at the same rate as in-person visits for mental health, chronic disease management, follow-up appointments, and initial consultations. Here's why this matters. If you live rural, have transportation barriers, or can't take time off work for appointments, telehealth access is life-changing. Mental health care particularly benefits. Therapy by video is as effective as in person for most conditions. Let's talk about AI disclosure requirements. Hospitals using artificial intelligence for diagnosis or treatment recommendations must disclose this to patients.